Better Health today, we're giving the guys a little of our love.
That's because it's Men's Health Awareness Month. Fellow men, we need to be proactive.
Yes, sometimes you guys are not good about going to the doctor and getting your screenings, but joining us to talk more about the important screenings that you should consider are Dr. Joseph Brophy, Medical Director for Prohealth Physicians Express Care, and Andrea Ravitz of Access Health CT. Welcome to both of you.
Thank you very much. Thank you for having us.
In general, men are not as, is this true or is it just a stereotype? Men are just not as good about following up with what they need to do as maybe women are?
It's true.
It is true. Okay.
And some of it has to do with, kind of maybe the machoism with men where they don't want to seek help, a bit too tough, or just maybe afraid of a diagnosis or just not informed.
I know guys at the gym who will not go for a colonoscopy just because of the whole procedure, and they're afraid of it. I'm like, guys, you have to go.
Yes.
You're over a certain age, you got to take care of this, and you have to get in there. So this is just one of the types of screenings that we're talking about.
Yeah, absolutely. Colonoscopy is super important. Colon cancer, one of the leading causes of death in the U.S. And screening can start at age 50, but then depending on some risk factors,
sometimes earlier.
Maybe earlier.
What are some of the other screenings that you recommend as people are thinking about Men's Health Awareness? If you haven't done X, what do you need to do?
Yeah, well, the main thing is getting in with your annual appointment and keeping those appointments. And when you're there, blood pressure screening is super important. Blood pressure is known as the silent killer with the stress that it puts on the body. And then there's also screening for depression, obesity, diabetes. Some newer kids on the block would be the low radiation CT scan for the smokers, age 55, and then of course the PSA testing for prostate.
And Andrea, you guys are doing a screening for men and everybody else.
Yeah, we're actually going to be participating with you guys at the Travelers, doing some blood screenings. And we're very excited to just be raising awareness of how important preventive health care is.
It really is. It's terrific. Yeah. What's a good number? I'm 120 over 70, I think. Or is
that's a good number.
That's a good number.
That's a good number. Yeah.
When do we start getting into the
pre-hypertension?
Yeah, the pre-hypertension.
That's so now it's 120 to 129 as the top number, over 80, and so a good blood pressure is below 120 over 80.
120 over 80.
Yeah. So now we're below that number. Before we would say 120 over 80 was a normal blood pressure.
Okay, so that's what I was saying. I was thinking that not much wiggle room, but 120 over 80 now is not normal. It's the high. You can't go. You don't want people getting more than that.
Right, leaving that 80, the bottom number at 80, and increasing to, let's say 129. That would be pre-hypertension.
So at the Travelers, Andrea, people are going to walk by. They're having fun, but it's just you can stop right in there and it's free. And it takes what, a minute to get your blood pressure done?
Yeah, and we're also going to be there, providing information around general preventive screenings that you can do outside of this event that are so important when you have a healthcare coverage and a plan that you should be using. So we're really, pushing this new campaign, Choose, Use, and Be Well, with the whole concept of choosing a doctor, using your plan so that you can be well.
And we should also be on top of preventative care as opposed to, uh-oh, I've got it.
Exactly.
Tell us a little bit about that.
Well, screening and early detection is key. So, that's before things progress to, undoable damage. So if we're screening for high blood pressure, high cholesterol, well, we could intervene. We could, recommend some diet, exercise changes, and then possibly some medications to modify these numbers. And in theory, if we get to the appropriate numbers, then we're prolonging life.
Right, and people may not think, oh, well, if they find something bad, oh, it's going to be awful. But there's some simple things people do. You might say, hey, we're going to change your diet a little bit. We're going to have you walk a little bit before you even recommend medications or other things.
Absolutely. It depends on how severe the blood pressure. I mean, obviously, if you're very high, there may be an indication for medicine right off the bat, depending on your family history, other risk factors that are going on. But yeah, just with the pre-hypertension or hypertension at a low level, we're certainly going to recommend right off the bat some diet changes, decrease in sodium, staying away from processed foods, high fatty foods, and some moderate exercise, 30 minutes, maybe 3 to 5 times a week.
Yeah, but if you're at the Travelers, check it out.
Right, absolutely.
Check it out, why not? You can say 4 and hopefully have 120 over 70.
Right.
That's right. Thank you guys for joining us.
Thank you.
Of course, thank you for having us.
The Access Health CT is again hosting a blood pressure screening. That'll be next Friday from 10 in the morning till 2 p.m. at the Travelers Championship. You will find the team inside the Channel 3 tent. Maybe you can say hi to us too in the fan zone. For
more information on how Access Health CT can help you on your journey to good health, visit accesshealthct.org. Thank you, Jen and ladies. We appreciate that so much for being with us.
Thank you very much.